So that's the fantastic thing about the biceps is that you can manage, or the elbow, you can manage very well. And I think a lot of people struggle to understand that is that although you've torn the muscle and it might look very much like, we call it the Popeye sign, you can manage very well without necessarily getting it surgically sorted. I know we're going to talk about the surgery and we're going to talk about what it looks like post surgery and stuff. And we've got some fantastic videos to show you guys. But if you manage them appropriately with gradual load rehab, setting expectations, and most importantly, treating the person in front of us, you said it rightly. If you've got a manual job, you will need to get that sort of fixed and looked at. And the problem over here is that as physios, we struggle to sometimes make that urgent referral happen sooner. And even if we do, we sometimes don't know how to sort of connect to surgeons like yourself to get that surgical intervention. And we're going to talk about how soon do you need to do it? Like how, there's a time frame, and I know you and I sort of greatly sort of discuss this time frame of how quickly should someone get surgery. Let's go on to the next slide. So what is physio, and how is it going to be any benefit to someone if, for example, they're going to need surgery in the first place? So while they're waiting for surgery, there is no reason why we still can't do stuff like managing that sort of initial injury, getting that sort of inflammation down, but just by getting them to sort of, get some ice on it, getting them rehabbing it, getting them to still train their rotator cuff. So the great thing about the biceps and the area is that you can still do quite a bit of movement with the shoulder, which, then leads to my next point is that because the person's had the biceps injury, that doesn't mean that we should stop them doing exercise. They should still stay fit, they should still stay active, they should still get moving. And I love doing a bit of manual therapy, giving a bit of pain relief, but I wouldn't sort of dig my finger in there, trying to basically massage the tendon, because we all know that massaging tendons doesn't really work.